Hello and welcome to another edition of ANNTalks, a series for nurses by nurses. I'm Bordelon and I'm your host for today's episode. So today we're going to talk about mentoring and coaching. In healthcare we often talk about precepting new students or helping build the next generation of care provider and helping to mentor or coach or bring to elevate the skill set that we of our providers to optimize the care that we provide for our patients. But do we actually understand the difference in the two? Do we understand how we can utilize each of these very particular behaviors and actions to hone the skills, whether it be of a clinician or to really start shining the next leadership group within a unit, within a hospital, within a clinical setting, within healthcare overall? Mentoring and coaching are commonly used interchangeably, but they're very critical. They're very critically different from one another, and they're very different in approach and result. So I want to spend some time really going through each of these and to showcase how we can use a set of specific skills for each and bring in that next generation of leader or fine-tune the skills of a clinician to improve the care that they deliver. So let's talk about coaching. So, whenever we go through nursing school or whenever we become preceptors within a clinical setting, it is very common that we become coaches. We coach that next generation of provider. We coach that student. We coach that new graduate. And the reason I say coach is coaching is short term. It's very task driven. It's based on performance. A set of performance standards that have been set up by the unit, by the hospital, by the clinic, and so forth, by the providers for that matter. There's a set of very specific skills that need to be developed or competencies that need to occur. Well, coaches they're used for that reason. Coaches are usually done, they have a group of coaches within a clinical setting, say for instance in the neonatal intensive care or any newborn care environment. You'll have a group of preceptors. They commonly precept new graduates. They do onboarding of new employees. They might coach on a new process, a new policy or protocol that occurs. These coaches are ones that get you into that confident space, if you will. They're very performance driven, meaning that there might be a checklist that's involved. There is something that is very deliberate. There needs to be a deliberate set of actions. Well, as they coach you, as someone coaches you in that space or coaches you on that skill set, then you'll check off those standards as those are being met. Coaches may or may not be paid for service. So say for instance, it's an outside clinic type setting, or you have a group of coaches who come into a clinical space to train you on a new piece of equipment. Say, for instance, there's a new ventilator, a new blood glucose machine, a new monitoring machine. Maybe there's a new feeding device for infants with craniofacial defects, such as cleft lip or palate or Pierre-Robin syndrome. So any of those type situations where you need to be coached onto a new skill or behavior, that's where coaches come in. Coaches typically operate independently. They can operate independently outside of a facility, but they can operate within an organized facility such as a hospital or clinic. They can be done for remedial purposes. Say, for instance, you have a simulation or a set of onboarding simulations or activities that you have people or new nurses take on. Say, for instance, someone doesn't perform up to par. Maybe they don't perform the set of skills as they should. You can then remediate that person using a coach. It can be a one-on-one type scenario where that coach can then remediate you into a competent zone of that skill. Okay. Maybe the coach can be, like I said, usually a one-on-one type scenario because it helps strengthen that skill set development. Coaching can be either one-directional or bi-directional. It's usually one-directional in the sense that they're giving you instruction, they're assessing your understanding of that instruction. Coaching is typically transactional. So a lot of people might get a little confused by that. What is transactional? So transactional is the type of leadership or type of activity that promotes compliance with existing organizational goals and performances. So if your unit has a set of existing competencies that need to be checked off, meaning they need to be articulated whether or not you're competent in that, in a pre-existing set of organizational goals. Well, that's where your transactional leadership, okay? That's that transactional piece. Coaches are transactional. They make sure you maintain competencies, they stay in line with organizational goals, and they help your performance improve or maintain your performance, okay? They're content experts, meaning your coaches are those who have done this for a long period of time, or very competent, or very expert in that particular task. Another great example is with PICC line insertions. So any of these peripherally inserted central catheters, you typically will go to a class. Well, that class is filled with coaches. Those coaches, CPR, another example. All these coaches are experts in that area. Then what they do is they assess your skill set. It's very behavior driven. Again, it's skills and behaviors, skills and behaviors. Now, let's talk about those who are interested in more. So say, for instance, you have a unit of very strong-willed people, very competent in their actions. They're filled with coaches, but you need a new set of leaders, or maybe you want to help build your leadership depth. That's when you start thinking mentoring. Mentoring's long-term. It's very, very structured. It's organized process. And mentors will be very much in tune with what the needs are on a larger scale. So they challenge you. They make you uncomfortable, which is important to understand what that means. Being vulnerable, understanding where your strengths and weaknesses are. When you start recognizing your strengths and weaknesses, then you have identified, as the first step, you've identified what can be changed. Well, mentors are part of that process. All effective leaders, all effective long-term leaders or people who want to get into leadership have mentors. Some have more than one. It's a long-term relationship where mentors operate by assisting those people being mentored to a bigger goal. They're pulling you out of that safe space of skill-driven, task-driven, into the more conceptual, larger scale of understanding how one thing influences another, how you can become that transformational leader. That transformational leader is one that focuses on increasing the motivation and engagement of the participants. That's really important to understand the difference in coaching and mentoring. Coaching more short-term, more task-driven, more behavioral, more transactional, where mentoring is more long-term. It's larger scale. It's a very organized process. There's a very important piece of that is that transformational aspect and how they help build your ability to move beyond just the skills and to look at leadership in a larger scale. So I hope this has been very helpful for you, and I hope that you can then take this information and learn more about the differences in coaching and mentoring. And also look at Ann's website. The Academy of Neonatal Nursing has a lot of great information on their website on professional development and growth. Please access that through their website and just peruse and look around at opportunities to help build your leadership abilities. Thank you again for your time. We look forward to hearing from you next time.